Good evening. Welcome to Refuat Hanefesh Live Conversations. My name is Dr. Ariel Mintz. I am the Executive Director of Refuat Hanefesh, and I am the host of the live conversation tonight. This evening, we're privileged to have Rabbi Dr. Shulman with us. He is a board-certified general and addiction psychiatrist, and he's the author of numerous book chapters and articles on psychiatry. He's currently working as a fellow at the Columbia University Medical Center, and he also has a private practice in Teaneck, New Jersey, where he specializes in psychiatric disorders, employing both medications and psychotherapy. And tonight we'll be talking about the Jewish approach to happiness and CBT, or cognitive behavioral therapy. And I am very excited for this topic. It's something that we've had on our agenda for a while, and tonight we will get to discuss it. For all of you watching who have any questions, you could feel free to post them directly on our Facebook page, or you could anonymously send them to info@refuathanefesh.org. So I'd like to start this conversation, Dr. Shulman, by asking, initially you were the one that proposed this topic. You were very excited about it, and I liked it very much. Can you explain just what your impetus was for choosing this topic and why it was so important to you?
Sure. Just before I start, I wanted to thank you, Ariel, for including me again, and I guess also welcome everyone here on Mother's Day, all the mothers, happy Mother's Day, and everyone else, happy Mother's Day as well, and also to say shkach for all the sort of keep up the good work in terms of trying to increase awareness about mental illness, decrease stigma. Part of what I want to talk about tonight is trying to prevent stigma and sort of increase empathy. And so that's a good segue into what we're talking about. So the reason I chose the topic was because actually it's been a long time coming. When I was a student in Yeshiva in Israel many years ago, I'm not that old, but I'm old enough. So it was more than 10 years ago. I read this book that had a strong impact on my life. That was the book Gateway to Happiness by Zelig Pliskin. I don't know if people still read that book, but it was quite popular, and I think it's kind of one of the classics in terms of psychology and Jewish thought. So, one of the kind of themes of the book is, I would say, it's classical CBT thinking, but I had never been exposed to it, and I was sort of excited by it. It was, a person has some control over their emotions, and a person sort of from the book's perspective, a person is obligated to be happy. And there's a sort of a simple way to do that. And the simple way to do that is by rethinking things, sort of take a positive perspective, see things in the positive light. And there's some Jewish sources that are cited. So, always take things for the best. Everything happens for the best. So if you do that, then you'll be happy. And, at the time I found it to be sort of very compelling. I guess as time has passed, and now I'm actually a clinician, and I see lots of patients, and I've talked to a lot of people in sort of suffering with mental illness. I learned that things are more nuanced, and actually that way of thinking without any sort of counterbalance can actually be kind of dangerous. And that was the reason why I chose the topic, because I wanted to get the message out that we should think about other things as well. So not to say that message was wrong, but give it a little bit of more nuance and help people think this through a little more.
Sure, and that makes a lot of sense. I would like to ask just, you mentioned, so now that you are a clinician yourself and you see the more nuanced approach, just taking a step back, my experience is that maybe this isn't just a Jewish philosophy, but we actually see this, in the professional world as well, where many psychologists, social workers, psychiatrists are advocating for this approach. Is that factual? Am I wrong on this? And if so, do they have it wrong?
No, I think you're right. I think that the book was sort of basing itself on the sort of prevailing approach of the time. to give a little background, I mean, we don't have to go all the way back to Freud, but Freud was considered sort of the father of modern psychology, psychoanalysis. Sort of, he was said to have discovered the unconscious, the talking cure, the idea that through just talking, people can have therapy and sort of can feel better and can be healed. So sort of he ruled the day for a while, but when the CBT therapists sort of came onto this, there was two general. So they started it more behaviorally, which means, so behavioral approach means sort of we can focus on behavior and sort of action and connecting that sort of good things with things, positive thoughts and things that we want. And then the cognitive side of CBT. So I should go back, and so I'm talking as though everyone who's listening is a clinician, but cognitive CBT stands for cognitive behavioral therapy, and it was sort of the psychology's next stage after the sort of the psychoanalytic approach. And the cognitive side of CBT, sort of the C of CBT, so the cognitive behavioral therapy, was initially often thought of in the way that I described sort of Zelig Pliskin's thinking, which was what causes a bad thought? What causes a negative thought? It's because the thing that causes it is people have some mistaken belief, an underlying assumption which is incorrect. People fall into certain patterns of maladaptive thinking. They talk about there are lists of different ways that people think incorrectly about the world, sort of catastrophizing where everything is all bad, black and white thinking. And so the thought of how to fix that problem, according to many psychologists, and I'm not saying this is totally wrong, but I'm just trying to say that we have to think about this in a more nuanced way, is that we have to rethink things. So if someone, let's say, I'll just give an example. So let's say someone's very nervous. Let's say a person's nervous about losing their job. So the approach would be to say, well, why are you thinking about this all day? Chances are you won't lose your job. Even if you do lose your job, find another job, or things will work out. So that's sort of that would be sort of an outsider's way of looking in and seeing someone sort of paralyzed by anxiety that might say, well, look, the anxiety isn't helpful for you anyway. So think about things in a more positive way. Think more. Change the way you're thinking, and we'll solve the problem. So there sort of was this strand in the philosophy of psychology, and there are many clinicians which sort of are strong proponents of this approach. I think so. I want to talk more about it, and please cut me off at any point if you think I'm rambling on. But I think that we sort of, there are dangers to that approach, and I want to talk about some of them.
Sure. Before we get into the dangers, I'm also curious on the other side. We mentioned, the clinicians and their view, and you talk about Ernst Lifkin and, kind of bringing the Jewish approach to it. And you brought in Freud and how he's kind of the father of psychotherapy. Very interesting figure, a Jewish person who really has left his large mark on psychiatry, psychology, but also in the Jewish world, from what I've seen, there's a lot of pushback against him for his views. And maybe it's changing nowadays, but I think there's a perception that there's a lot of problems with psychotherapy because of the views that Freud had so long ago. Do you think that Rabbi Slifkin's approach, is that something that would be endorsed by, let's say the leading Rosh Yeshiva, our rabbinical leaders out there? Or is this something that maybe they would find problematic as well?
I think they would be much more comfortable with that approach. I think that it's certainly, made its way into the thinking of many rabbis, and I'm not sort of, again, not with judgment, but saying I think that it fits more simply into many Jewish sources. So, for example, I mentioned before, there's the Talmudic passage about how I don't know if I should tell the whole story. There's a man who didn't get to stay in a city, and he was sort of a traveler, and he got thrown out, and he had to sleep in the woods, and then his candle went out, and his donkey died, and then he woke, and then the morning he woke up and found out that actually bandits had come and sort of destroyed the city, and had it not been that he was thrown out and his candle went out and his donkey died, he would have been killed as well. So he said, this is also for the best. So that's sort of a really strong sort of
Cognitive
strong
approach.
espousal of this approach of saying, look, if you feel like something's bad in your life, just realize that it could have been worse, and God's looking out for you, and therefore, your negative thoughts or your feeling bad are actually mistaken or misplaced or almost, and could, in a way, viewed as negative from sinful. So I think that actually this has actually taken off in the Jewish world, and I think that partially because of books like Gateway to Happiness, and also because there are many sources which support this. So I think it actually is much more accepted as opposed to Freudian psychoanalysis, and Freud himself wrote sort of very negatively about religion. So
Sure.
I would blame no one for sort of being skeptical. And I myself, I'm skeptical of everything, but Freud I'm also skeptical about. I think he had a lot to teach us, but obviously I wouldn't say everything that he wrote was sort of should be taken as the gospel truth. So.
And so in your experience, you've seen the Jewish community differentiate between classical psychoanalysis and some of these newer forms of psychotherapy, such as cognitive behavioral therapy, where there's more of a buy-in in the Orthodox Jewish community and not seeing it as negative based on Freud starting and everything.
Yeah, I think so. I mean, I don't know if people are thinking about it in as nuanced an approach. I mean, I don't know if everyone has this much sort of perspective or background, but I think that people are talk a lot. I mean, I think in some ways, I think it's not necessarily only clinicians that are involved. I think sometimes clergy will be involved and teachers will be involved in sort of teaching some of these things as a way of staying positive, and it doesn't necessarily have to be in a clinical context of telling students, just stay positive about your life. Things are for the best. If we believe in God, we believe that God is watching over us, and he'll take care of us and things will work out. So I think that yes, it's in my experience, it's gotten with pretty strongly embedded into the Jewish world, actually.
Sure. My only counter to that would be what you're describing to me sounds like emunah. And I've heard people say before, going to a psychiatrist or psychologist is a lack of emunah. And so, yes, believe in God, believe that things will get better, have a positive attitude, but don't go to psychotherapy. Don't go to, something that was created by Freud, who oftentimes was antagonistic towards religion and did come up with these theories that don't fit into the box so well.
Sure. I mean, I think that there's a fear of going to, I think it's a little bit off topic, but I think there is a fear to go sort of the field in general, probably because of Freud. And that's what I was saying. I think that in many ways, this has actually been taken on by non-clinicians as a way of thinking, and it's sort of a danger on both ends. I think that, and I think there's some clinicians which are more accepted, sort of if you're Orthodox. You can't see my yarmulke, but I am wearing one. So I think that I'm not going to say everyone, but I think that some parts of our community are more comfortable with someone who's Orthodox themselves. And look, going to psychotherapy is very personal, and there is an element of trust that has to happen between the clinician and the patient, and the field has been secular, and I think it's an academic field, and which is a good thing in some ways, because it's very scientific, and there aren't people are sort of very I would say agnostic about the world theoretically. So there is a value in that, but there is also maybe sometimes people can be a little too antagonistic to religion, I think, in my experience occasionally. And so someone who's more religious might feel like this is something that's not for me. It's not safe. It doesn't feel like a safe space. I actually once gave I wasn't expecting to talk about this, but I once gave a talk with a friend of mine who's an Orthodox Muslim woman, where she wore hijab, and we talked about being Orthodox, sort of religious therapists, and how that relates to our practice as therapists, and how that and it was interesting because there certainly was, it was to it was a group of therapists that we talked to, and there was sort of people saying on both ends that um, we don't really believe in this, but we'll put up with you. And there's also, well, we really need to embrace people's experiences, and we have to accept people and accept and sort of be more welcoming and so I think that's something the field struggles with, and I think as a field we should do a better job of sort of understanding religion is something so deep to people's experiences that's not ever a clinician's job to judge a person regarding that, or push a person one way or the other regarding their religious choices in both directions, I'd say, in being more religious or not being religious. Our job is sort of to be professionals and sort of help people with their mental health rather than sort of solving their philosophical religious problems. I mean, things can be connected, obviously, but it's a personal choice for each individual and how they live their lives. So, long answer to a question
Sure.
I wasn't expecting to answer, but an
Yes.
important question, I think. So.
Yeah, and I would agree with that. I'd also point out that actually, it's interesting that I have also seen, in the academic world, a little bit of a negative view towards religion, even though we know there's so many studies that have come out showing the protective value of religion, and it really could be helpful and healing when you do have a psychological disorder. But bringing it back to our topic, and sorry for derailing that. So fill us in on some of maybe the negative aspects of cognitive behavioral therapy and how that might not always be the right approach.
Okay, so first of all, I don't want to call it a negative aspect of cognitive behavioral therapy because I think that cognitive behavioral therapy done correctly would not have any negative aspects. Also, I wanted to sort of sell that the other sort of more modern approaches to cognitive behavioral therapy it's been termed in the field the third wave of cognitive behavioral therapy. And I could give you a little more details about that later, but just to say off the bat, it's not that I think that there's a negative to cognitive behavioral therapy. I think this specific approach and focusing on the idea that we can change our thoughts by rethinking things, reframing things, and focusing on that can be dangerous. And I'll tell you, I'll tell you why. I'd say there's a couple issues. Let's talk about sort of from the individual patient level and from a person's experience. If a person sort of is truly suffering with, let's say, anxiety or depression, the reality is that 9 times out of 10, simply telling a person, I would say 10 times out of 10, telling the person, rethink the way you're thinking won't work. And what often will happen is, because of sort of the neurobiological pathways that are happening in the person's brain, the person will say, well, I shouldn't be thinking this way because my clinician told me I have to change the way I think. And so this starts a cycle which actually leads to more frustration and depression, where a person will think, well, I had a negative thought, I had an anxious thought, I shouldn't be having that. I need to think some other way. I need to think some other way about the problem. So let's say, for example, the guy who's afraid he's going to lose his job. I need to think that, figure out reasons why my boss will not fire me. So then it becomes this cycle of a very scary and frustrating cycle of trying to control thoughts, which leads to even more depression and anxiety, because there's a sort of the control agenda becomes a source of anxiety as well. Like, I can't control my thoughts. I become more anxious about that. In fact, a lot of what drives anxiety disorders is, the anxiety itself, is that when a person experiences some sort of physical anxiety symptoms, that feeds more anxiety, because they feel like, I shouldn't be feeling this way. This is very scary. And that's oftentimes how the disorder can sort of get even more and more extreme. So that's from the sort of individual perspective. I think that first of all, it doesn't really work in that way, in that simple a way. And we can talk a little more about how I think the classical CBT therapists would really do it sort of correctly. Um, and it also creates a feeling of invalidation of that experience and judgment. So the patient can feel, or person can feel, I shouldn't say patient, someone who reads this or hears about this can feel um, that I'm failing because I'm having these negative thoughts, and the reality is that no, you're suffering from an illness, or this is just a natural part of human experience, that you're in a really stressful, anxiety-provoking situation. It's okay to feel sad. It's okay to feel anxious in that situation, and that would be the sort of more correct approach. But it leads to this way of sort of starting, of saying, if you reframe it, you'll be happier. So it leads to that person feeling more depressed and more sad. I just wanted to also make sure I sort of make sure I can highlight the idea that besides the individual, I think there's a sort of a very strong negative influence on this way of thinking for family members and for individuals surrounding a person. If a person's really suffering with mental illness, and you tell a family member, well, if your relative who's depressed would just, think differently and reframe their thoughts, then they would be able to get out of it. Obviously, that's going to lead the family member to be more judgmental and sort of provide less emotional support, be less empathetic to that person's experience. And again, those are things which will actually be counterproductive and will lead to worse clinical outcomes, lead to the person feeling more depressed. So there's a sort of I'd say very grave danger of overemphasizing the idea that we can just rechange thinking, we can reframe our thoughts and things will get better. I mean, again, we can talk about the role of that in treatment, but focusing on that too much can oversimplify and actually be counterproductive.
Sure, and that makes sense. It's almost like the classic example of telling someone, not to think of a pink elephant. They're going to think of a pink elephant. When you're really focusing on telling them, what they should think or shouldn't think, it's not necessarily going to work. But we do know that CBT is one of the most studied therapies out there. It's very effective. And you said if done right, it could do a lot of good things. So if not through telling people to reframe their thoughts, how is it that a clinician should go about conducting CBT, and how does it work that it is helpful for people?
Okay, sure. So we can talk about that. So I guess I'll say I wouldn't say that I'm the world's expert on sort of the classical CBT. Again, I would say I more espouse the third wave CBT, which involves more mindfulness. But just to, I guess, say over what I've heard from my teachers, quote my rabbis or quote my psychological rabbis. So let's say you have the situation where someone's thinking it's sort of a negative pattern. Let's give an example that the person, let's say, experiences more anxiety than they should in the workplace because they feel that people are judging them, or their boss is out to get them, or whatever. So you would never tell the person what to think. Or that's the first thing. You never say you need to reframe it, and you need to reframe it in this way. And the therapeutic element, I believe, they found in studies, is actually not in necessarily that alternative thought that you give the person, but it's actually in the flexibility of being able to let go of their initial thoughts, to sort of realize initial thought may not be that powerful. So to say, I had that thought that my boss is going to fire me, but that may just be my mind sending me a message. So that is an important part of the therapy, sort of teaching people that their initial thoughts may not be real, and sort of I'm really jumping to I can't help myself. I'm jumping to ACT therapy. So it's called diffusing from the thoughts. So saying I'm not going to connect as much with that thought that I'm having. So I think a classical CBT therapist, and I do this myself sometimes, would be to say something like, well, if I were to ask you, a friend of yours, looking at the situation from the outside, how would they see the situation? Would they agree with you about your boss? And then then the person will be able to think, well, they'll be able to think about, my friend maybe would think this way. Sometimes I'll ask, what do you think I would say about that situation? Because a lot of times, for better or for worse, patients will think that the therapist is sort of a very wise, way of thinking about things. So I'll say, what do you think I think? So it's actually their wise brain, sort of the part of their brain which is sort of calmer and thinking more carefully about things and they'll say, well, you'd be thinking this and this, and they actually will, and I don't have to say anything. I'll just say, okay, so you figured it out. So I think the therapeutic element there isn't the new thought necessarily. It's the ability it's training a person. It's like I'd say it's a difference between saying that you can sort of rote memorize something and saying you learn these skills versus sort of learning a new sport, let's say. So I learned how to ride a bicycle. So what's happening in the therapy session is a person is learning to not take their thoughts so seriously initially, and being able to rethink things, be more flexible, be able to sort of think a little differently.
And it's not necessarily the reframing to think positively. It's more the maybe just taking away some of the negative thoughts and not focusing so much on them, and admitting that maybe that's not exactly how things are exactly. Am I understanding that correct?
I wouldn't say taking away the negative thought. I would say connecting less, giving it less emotional power, and that's sort of
So that also I think is going back to ACT. Am I right on that?
That is the ACT.
But so CBT itself has incredible data behind it. ACT is a little bit of a newer therapy, but within CBT, what is happening?
I think that's what's happening in CBT as well. I mean, I think what I would say is that when a person is, let's say a person is going through and let's say doing their checklist and going through an ABC worksheet and saying, this is what happened to me, this is my thought, this is the evidence I had for it one way or the other, and this is how I think about it. I don't think that it's just simply about reframing. I think that some of the ACT actually happening without being overtly taught. So the idea of saying, I don't have to take my initial thoughts so seriously, right? I think that may be part of what's helping a person. Okay. I think that some classical CBT therapists will acknowledge that that's part of what's happening. I don't think that there's an argument about it. It's really more what happens in the room.
Sure.
And I think, sort of from the classical perspective, it's not just a simple reframing. It's not that I replace the thought with a new thought. It's that I train my mind to be able to work on a new pattern. So, like I was talking about the bicycle. Let's say I'm working out in the gym. I'm working the muscles of another way of thinking about my life. So that's something that I would say let's say I was talking to a relative about this way of thinking. I'd say, look, it's not that your relative can just rethink their life and they're going to feel better, right? They're within a certain pattern of a certain thought pattern. What you want to work on is helping the person practice other thought patterns, but those things change. It's a path towards changing. So, don't expect immediate results. Don't expect the person to suddenly be cured overnight.
So even this whole approach, I imagine at times the patients or the people will feel worse.
Which approach?
Even with looking at kind of reframing your thoughts in terms of just allowing them to not have as much power to the approach that you're taking. So they're also, I imagine, focusing on that may make people feel worse initially, at least.
Well, but do you want to talk about ACT? You're saying with ACT, I wouldn't say
the CBT approach, whether it's working through ACT, acceptance commitment therapy, or whether it's working through the classical understanding of cognitive behavioral therapy. So the way you're presenting it, are you saying that this is a way that everybody could do it, and then they won't feel down about themselves, and they could achieve the goals without saying that everybody, reframe your thoughts and then you're going to be happy?
I think it depends on the illness and on the patient. I think that classical CBT sort of, if you think of it as, there's different, we're oversimplifying. I mean, I think classical CBT would say that for OCD, for example, we should not ask the person, well, consider what a wise person would say, because actually that could become a compulsion in itself. So in times it could actually be dangerous to do it. And in that case, really, we should focus on the behavioral approach of saying, let's, again, expose the person to the things that are making them afraid, allow them to desensitize themselves. And so for some illnesses, it's very dangerous, I'd say. And that way of thinking of saying, well, tell yourself everything is fine. So I've heard that, unfortunately. And I like to say this. I think it's an important thing to sort of spread the word about. Specifically with OCD and with someone who's sort of trapped in anxiety cycles, telling the person to remind themselves they're safe, do things to try to make the anxiety less in their mind can actually be very counter-therapeutic and can be dangerous. So in those cases, we want to focus on the behavioral approach or the ACT approach, which doesn't sort of fight the thought. But I think for some, for sort of depression, I mean, there's very good evidence for sort of classical CBT for depression. I think it can be very helpful. I'm not against the approach, but I think that it shouldn't be oversimplified. It shouldn't be taught as sort of just rethink it, just reframe it. I mean, a good CBT therapist will say also, besides what I mentioned, sort of asking the person to think, what would another person think? They might also, the sort of Socratic questioning, sort of, why is Socratic questioning important? I mean, why do you have to sort of ask questions and help the person see another perspective? Why not just say, well, think about another way and let me tell you that approach? The reason is that this isn't about just sort of finding an alternative thought. It's about helping a person, again, practice that muscle of being able to be flexible and being able to see that initial negative thought, which is part of the illness, that the brain sends that thought as part of the illness. Learning how to deal with that in a healthier, in a sort of a different way. So
sure. Before we continue, I'd just like to orient the people that are joining now. I'm with Rabbi Dr. Shulman, a psychiatrist who's talking with us today about cognitive behavioral therapy and the Jewish approach, how they may be the same, how they may be different, and how we could view, when people are going through a psychological distress, maybe some of the best methods for helping yourself or helping that person that and how that may be something that you've heard already, but also some new approaches to it. So, speaking in terms of other people, so you spoke before about the harms that could happen when we learned that, just reframe your thoughts, and that's kind of the perspective, some of the harms that could happen with family members. Mm-hmm. So what would approach you recommend be for family members, how they should speak with their loved ones to maybe help them get through an anxiety disorder or depressive disorder?
Oh, that's a tough one. So I would say that if the first thing, if let's say someone sort of has been thinking this way, that if they would just think a little differently, they would get better, and you haven't had sort of good results. The first thing to do, and I think this is sort of, we talk about this a lot with regards to a different diagnosis, borderline personality disorder, but I think it's true in a lot of psychiatric disorders, is just acknowledging the person's experience and acknowledging how hard it is, and sort of trying to be empathetic that you're suffering and you're feeling really bad right now. That's actually really, I'm having trouble even saying it to you now, and we're not even in a clinical setting, but it's actually a really hard thing to do. It's really hard to sit with the person's suffering and sort of just acknowledging it and sit with it and be empathetic. But I would say that's that's always the first stage, to sort of say, if a person's depressed, anxious, sorry, I'm having my computer just told me it's going to restart at 9:50.
Wow. well, maybe we'll have to speed up this conversation.
But I'm going to try to keep that from happening.
Okay.
But anyway, with regard, so the first stage with dealing with, I'd say, anyone who's suffering with mental illness is acknowledging their experience and sort of not validating that experience, not saying something like, you shouldn't feel sad, you shouldn't feel depressed because look how great your life is, or if you would just work harder and you would just try harder, you would feel better. Even if it's true, even if that might be true, that, let's say, for example, I'll say, like, oftentimes with a patient, I'll be thinking, look, if you would just exercise more, you would just get out more, I'm thinking that you would probably feel better. But I can't say that to a person necessarily because it can feel very invalidating to a person's experience. So the first stage is always to try to be empathetic, validate the experience. And then I think it really depends on, I mean, I can't, I really don't want to give blanket statements about how relatives should deal with their loved ones. For example, with OCD, um, there's a very specific way that loved ones can be helpful. Not providing reassurance, working with the therapist in a very close way. So for depression, it may just be being supportive and helping the person do things that are helpful and therapeutic for them. So exercising more, getting out more, doing more. If the person comes sort of and says they're feeling having negative thoughts, acknowledging like, look, it sucks. It's really hard and I'm really sorry and I'm with you. And if the person finds it helpful to sort of try to think more positively, you can work with them on that. But the first step always has to be empathy. So
Sure.
I think that's a good simple answer. Since it's obviously a sort of a big question, which is very case dependent. So
Sure. I have plenty more questions, but we do have some questions coming in, so I'll start to ask some of those as well, if that's okay with you.
sure.
And I encourage other people that are watching, if you have questions, you can either post them on the Facebook page or send them to info@refuathanefesh.org, and we'll try to get to as many questions as possible. So, we still have maybe some more nuances of CBT that we could talk about. Hopefully we'll get to ACT therapy as well. But, the question we have is, can a person practice CBT without a professional? And if so, what are some of the ways that a person could do so?
I think, yeah, I mean, the question is, should you or can you? I think everyone could benefit from some of the wisdom of CBT. I think now with sort of as academia has really progressed with the data, for example, economics. I'm a big fan of behavioral economics. So Daniel Kahneman, who's from Israel, from Jerusalem, so he won the Nobel Prize. I know people have heard of him. He won the Nobel Prize in economics because he was able to show ways that people make mistakes in their thinking. And a lot of those things, CBT, are the things that CBT calls sort of the cognitive distortions. So he says them sort of more generally that humanity makes certain mistakes. I think everyone could learn from the sort of the wisdom of CBT and sort of ways we make mistakes, ways we can think more positively. I think positive psychology is great. I try to do positive psychology exercises with my family. We do a little exercise called Roses and Thorns, where we talk about two good things that happen to us and one bad thing, around the Shabbos table, to try to sort of talk about good things and also acknowledge that things aren't always perfect. So I mean, I'm a big proponent of involving pieces of the wisdom of cognitive behavioral therapy is a huge field. Obviously, you can't even sort of call it one thing, but I think that everyone could and should integrate it. And I think there's books like the book I think Positive Psychology or Positive Thinking by Marty Seligman. It's really good. My brother was a big fan of it. Actually, also he's a
Are
lawyer,
CBT
so.
and positive psychology the same, or are they different fields of psychology?
I think positive psychology is a branch of CBT.
Okay.
If I'm not mistaken, again, I'm not the expert in these areas, but I believe they're related.
Okay.
And sort of on the same vein, I think that I always recommend people to read The Happiness Trap, which is an ACT book by Russ Harris. It's written for lay people, and it goes through a lot of things that I've mentioned, sort of talks about some of the things I've mentioned, that controlling thoughts can be negative, other ways of thinking about things. And I think it's great for anyone, certainly anyone suffering from mental illness and anyone to read the book just to sort of have that perspective. I think it's a great perspective. I think if a person's really suffering, it's always helpful to see a therapist. If a person sort of has had debilitating symptoms, suicidal thoughts, certainly I would certainly recommend finding someone who's professional to help you, because there are sort of benefits to having, it's like saying, can you teach yourself to become a Major League Baseball player. I mean, maybe you can, but it's always easier to have a coach. It's always easier to have someone work with you. I think a clinician can be really helpful and give perspective, and there's therapeutic things that happen in the therapist's office as well that can be helpful. I mean, I'm a therapist. I make some of my living from that, so I shouldn't, take everything I say with a grain of salt. But I do think that therapy can be very important, and I know. I guess just to be honest, on the other end, I just read a study by John Gottman that he wrote that with marriage counseling, when they did a control group, they gave people sort of the really good marriage counseling, or they gave him his book. Or the patients had the book. They actually found people did about the same. So
that sounds a little biased as well, though, potentially, if he's running the study.
Well, I don't think he wanted to find that. I think he wanted to find that being in his sort of high-end therapy would be good. But I think if someone's really motivated and they find a good appropriate book, it depends on the books. I mean, some books are really sort of not written by someone who's really knowledgeable in the field, and sort of can be misleading. But I think books written by people that are responsible and sort of write it in the proper way, they can be actually very therapeutic. So,
to expound upon the question, I imagine maybe what they're getting at, and you alluded to it a little bit as well, is the fact that getting a therapist can be very expensive, especially in some areas. New York and LA are well-known areas for this, where it's almost, if you want a good therapist, you're paying cash only. And oftentimes that's a struggle that people with mental illness have, that their treatment is so expensive, they're missing days of work, or they're not able to get a good job because of their mental illness. So it's a considerable expense. So, what's your opinion of, maybe some self-paced books such as Mind Over Mood, or, there are some, now online self-paced CBT courses. Sometimes you pay a little bit, sometimes, it could be completely free. What are your thoughts on maybe at least starting there, even if you have an actual mood disorder, anxiety disorder, and you are suffering, but you're worried that hiring a therapist will add a whole new level of stress for you? Is it worth starting with those books or those online courses, or are you potentially causing more harm to yourself by delaying getting into treatment?
I think if someone asked me that question, I'm trying to answer how I would answer someone who would ask me. I would probably say, I mean, I think it may depend a little bit where you live, but and if the person's really thinking about going into treatment and there's a cost issue, I do think that there are ways to find good therapy, even if you're using insurance. I think it's hard. I think it takes work, and obviously it's really emotionally difficult to try to sort of shop around when you're suffering. But for example, in the New York area, there are places that have specialty care that take insurance that I think are quite good. In my area, so for an addiction, I send people to certain places if I think and I think they're very high level quality programs, and they take insurance. With OCD, there's certain places that might take insurance. I think it's usually worth the effort to try to find the right therapist for yourself if you're really suffering at that point. I think if you can read a book or you can do an online course and it works for you, then I would never discourage someone from doing that. I think it's really hard for me to say without knowing the specific case, but I always try to encourage people that are sort of have a certain level of severity to say, I think it's better to try to be in treatment. I think if the person's functioning really well, I don't know who the person who's asking the question is, obviously. If you're functioning quite well and you're just feeling down, but you're suffering, but you're functioning quite well, it's a little bit different than if you're sort of just coming out of the hospital, you weren't able to work, things like that. Those are, I think, a lot of it has to do with functioning. If a person's not functioning well, then that usually is a sign that it's worth getting connected with someone who's with more professional help. Maybe that would be sort of part of the rule of thumb I would think about.
Okay. Another question that was asked is, what advice would you give to a person who wants to seek treatment but knows that their family or friends frowns upon seeing a therapist? I think, there still is some
No,
stigma out
no,
there.
I
And
understand the question. It's a tough question. It's unfortunate that, but I am very aware of that reality. And some of my patients have actually told me, my relatives think this is all this is all garbage. This is a joke. I mean, it can be obviously very counter-therapeutic when people say things like that. Um, I think the only thing I can say is you just have to try to. I think that I'm trying to think what the best is. The question how to talk to your relatives or how to think about it yourself. I mean, I think that people who think like that.
we're getting into a little bit of cognitive behavioral therapy already with that, in terms of how to maybe motivate yourself to go to therapy when other people are telling you not to go, that it might not be the
Well,
best thing.
I think that the evidence is that therapy is helpful. I think that part of what people need to sort of think about is therapy isn't magic. I mean, I think that sometimes in Freud's day there was a sort of a magical element to it. I think it's not magic. I think that sort of there's a human who's being paid to be helpful and is trained to be emotionally professional and not get caught up in some of the things that are happening in the room. And that can be really therapeutic for people. And I think sometimes explaining that to relatives and thinking that to yourself can be helpful. I mean, the evidence is that therapy across sort of all different psychiatric illness is helpful when you compare it to no treatment at all. I mean, when you compare therapies, it's hard to find benefits from one versus the other. But across sort of with suffering without help seems to pretty clearly people don't do as well. So I guess the way to motivate the thought that the piece of information I would try to give over is that it can really be helpful, and stick with it. If you met someone who didn't work for you, it wasn't right, try again and do your best.
Do you have advice for what this person might say to their friends or family when they're resisting it and saying, so you mentioned that studies show that it is beneficial, but if they're saying just go talk to your friend, what do you need to go pay to a therapist for some random person who's going to just listen to everything that's bothering you?
That's the thing. I don't think that friends are able to have the same role that a therapist can have. I think friends are really important. In fact, they could be more important. If someone asked me, should I stick with my friends or should I stick with you? I'd say, look, keep your friends. But I mean, good friends are important. But if a person's suffering with mental illness, the benefit of a therapist that again, there's sort of that because they're sort of in that professional role, there is a bit of emotional distance, there's an ability to not get caught up and try to sort of solve the problems, be empathetic, acknowledge the feelings. There's depending on which kind of therapy you're going for and which illness you have. If you have, for example, OCD, your friends aren't going to help you. You really need a specific kind of therapy, or PTSD. Specific kinds of therapy have been shown to really be helpful. Friends aren't going to be able to provide. They're not going to know how. A person who's severely depressed, I don't think it'll be that easy for a friend to provide that kind of balanced support that a therapist would provide. And certainly someone who's, let's say, knows they have borderline personality disorder, friends are going to get emotionally caught up in things. A therapist, their job is to help you manage those emotions without getting caught up in the emotions with you. So it depends on the illness to some degree. I mean, maybe supportive friends can get you through a hard time if it just was a hard time. I'd say when I've been in hard times in my life, there are times when I haven't gone to therapy, and I'm looking back, I wish I had gone. I feel like, and my friends got me through it. They did help me, but maybe I would have not suffered quite as long and quite as hard if I had sought out professional help. So.
Sure. Why don't we spend, the next few minutes talking about something that I think you wanted to talk about? Tell us more about what ACT is.
So ACT is a third wave therapy. So it's a therapy that was developed not too long ago. I believe in the 1990s or the early 2000s. I have to go back and check. And on one foot, I would say that it basically, I'm trying to sort of figure out how I can describe it, and I see we have 9 minutes left. So it basically says that as opposed to what we mentioned earlier, that we can control our thoughts, change our thoughts, it takes a different approach to the negative parts of and sort of the non-productive parts of what happens in our minds. It says the goal should never be to control either a thought or an emotion. Um, and a little bit, it changes the goals of treatment. So usually when you go to a doctor, a psychiatrist, say if a patient comes to me, they say, well, I want you to make me feel happier and have less negative thoughts, have less negative emotions. So if I were really, and I don't always focus ACT, 100%, but if I were focusing sort of through an ACT lens, I might say to the person, I might say,
Can you, what is ACT first? What does it stand for?
it stands for acceptance and commitment therapy.
Okay.
So we want to sort of accept the experiences that we're having, accept our emotions, and commit to the life that we sort of believe in. So again, let's say in my example, if I'm talking to someone, I might say something like, what if I said that our goal in our treatment wouldn't be to take away those negative thoughts from your life because you've been to 10 years of therapy, you've tried 15 medications. My goal in our treatment is going to be to help you live as committed and as rich a life as I can, and as you can, regardless of what thoughts and feelings are going through your mind. And I might even say, well, and hopefully if you do that, then some of those feelings will get better, but I can't promise that. That can't be the goal of what we're doing. So it's a little bit of a shift in terms of what our goal in treatment is. It's no longer stopping thoughts. It's no longer managing emotions. It's living a full life regardless of what's happening sort of in our subconscious and our consciousness. So that's sort of in a nutshell. I'd say that some of the
does that tie into mindfulness at all?
Yeah, sure. I was going to say that. So some of the skills that you learn through sort of you use are mindful skills. So for example, with emotions, so the one of the important elements, the ACT has actually a six-sided they call it a hexaflex, so the six sides of things where we want to move towards healthier thinking, or sort of healthier experience, I should say. I always thought that sort of matched up nicely with the Jewish star. But anyway, so one of the sides is with emotions, being able to be more present with our emotions. So an exercise I'll ask people to do when they're sort of being overwhelmed with anxiety or sadness is to say, look, let's not make the goal to make the sadness go away. Let's just breathe. So be mindful with our breathing, be mindful with our body, and just notice what happens in our body as we're having those negative thoughts. And actually, sometimes people will feel worse initially when that happens. But let's say in the mindful session, sort of in experiencing that emotion. But my goal is always to hope. I can't tell people this is the goal to make the feelings go away. But my goal is always that as they sort of breathe through it and experience it, they'll allow themselves to experience those negative feelings and eventually feel better. And actually, I think that Freud, even though he doesn't use these terms, but I think that Freud, one of the important pieces of treatment that he talked about was catharsis, when a person would experience a strong emotional outburst, but they would experience a strong emotion in the therapist's office. That was how the healing happened. I believe that sort of that's almost psychotherapy coming full circle, and we're acknowledging that we need to experience feelings in order to eventually live a more productive life, live a more full life. So that's the mindful side of ACT, and there's another piece of mindfulness.
Sorry, can I ask on that? So if I'm remembering correctly, I think Freud was a big fan of kind of getting out your anger, expressing it, and really, letting it all out there, not holding anything in. And that was the cathartic experience. Now my understanding is that psychotherapy doesn't always believe that that's the best approach. And ACT isn't necessarily about, expressing all your anger, but just being maybe aware of your anger and living with it, as opposed to, going and shouting at somebody.
Right. Well, that's the thing. I think what I love about ACT is that it's so nuanced. I think it's a result of all these years of um, research and thinking about psychotherapy that they're able to take that very nuanced approach to say, look, the goal isn't that you should act to go out and yell at people if that's not towards your values. We didn't talk about the values. But the goal is to live the life that fits with your values. So if your values are X and Y, then you should do that. But your internal experience, if you're feeling angry, let yourself feel angry and just notice that emotion. It doesn't have to translate into action, right? We can have an experience which is extremely powerful, feel really angry, and just allow that to be there, notice it. It's our brain sending us a message, but it doesn't have to translate into an action. So did Freud believe that you should go out and act angry? I'm not sure. I'm not an expert in Freud. I think that what I was referring to is that in the therapist's office, there would be this cathartic experience where there would be, maybe they would experience anger towards their therapist, and maybe that was sort of a really sort of acting out that experience of coming in contact with anger. Perhaps there was some of that. But I think that ACT would say the therapeutic element is being able to come in contact with your emotions, being willing to come in contact with your emotions.
Okay. Okay. So, with the last couple of minutes just tying everything together, how do we integrate kind of this CBT approach, especially with the new ACT viewpoint, that seems to be very helpful for a lot of people, with the Torah Jewish approach? How would you frame it in the way that kind of we could have a take-home point from this live conversation, and what we could do to either feel better or to accept ourselves and other people maybe who are going through a tough time?
Sure. So I think that the Torah approach fits beautifully with ACT. I have to say, if you read the book and you think about it, it's really amazing, because it's a very secular approach. I mean, the people that came up with ACT were not religious; they were very secular people. But it fits beautifully with religion, in that I think Judaism. We're speaking mostly Jews here, right? So I think Judaism, but all religion in a way, says that we should live by our values, and sort of stay focused on that. And that's really the guiding principle in our lives, which, again, so you sort of stick with the things you believe in, and try to live a life that's as close to that as possible. And with regards to dealing with our emotions, I think that the reality is that Judaism does embrace this, and I think that sort of focusing on only being happy all the time is a little bit of a sort of misconception. We're allowed to be sad when sad things happen. I mean, if you look at the Tanakh and you look at the Bible, all our heroes all experienced emotions: sadness, fear, love, hatred. I mean, there really was the full gamut of human experience is acceptable, and I think that it fits within the sort of, as we're moving along our path towards our goals, we experience all those feelings. I think negative thoughts. Again, so that's where there may be some of a little bit of differences, but I think that ACT would say you don't have to take those thoughts so seriously. You don't have to connect with them so much. And I think that the takeaway I would say from a Jewish perspective is, look, if we're going to say we should have emunah, the therapeutic way of thinking about that, from my perspective, is to say, look, I try to be a little bit flexible, try to see things in a more flexible way. I don't have to see things sort of the way I'm seeing them. Didn't have time to talk about how to deal with negative thoughts and ACT, so maybe next time. But live by your values, and try to allow your emotions to be there, but again, stick with your values. And I think that is I think that really is the Torah ideal, and I think that's probably the ideal of many religions. So.
Dr. Shulman, thank you so much for joining us tonight. You brought up some very interesting topics, and I enjoyed discussing them with you. If anyone has any further questions for Dr. Shulman, please feel free to send it to us at info@refuathanefesh.org, and we'll be sure to pass it along to him. We encourage everybody to tune in for our next live conversation, which will be June 23rd at 9 p.m., where we will have Yosef Gillers, who is the founder of Grow Torah, and he will be talking about the mental health benefits of nature. So please tune in then. And in the meantime, feel free to go on our website and make use of all the resources we have on there and be in contact with us as well. Thank you very much, everyone. Have a great evening.
Thanks for inviting